common question I hear is, how long does it take to recover from cataract surgery? Well, I'm Dr. Nimesh Pathak, and I'm going to give you a quick timeline of what to expect with cataract surgery. Most people are pleasantly surprised by how fast the recovery is after cataract surgery. On the day of your procedure, after your procedure has concluded, you'll typically be able to go home within about a half an hour, and for most people, that first hour or two, their eyes will feel a bit scratchy, and their vision will feel a bit blurry also. You will rest that first day, take it easy, try not to use your eyes, and then overnight, after you sleep with a little plastic shield over your eye, you'll wake up the following morning, and that scratchiness will be very, very minimal, if at all. And on that first 1 or 2 days after your procedure, you'll be able to get back to your normal activities, including going for a walk, watching television, walking around your home, working in your kitchen. Typically by the 1 week mark, you'll be able to do more of your normal full activities, such as driving, jumping, jogging, running, exercising. And typically by the 2 week mark, you should be able to get back into a pool if you needed to. Usually visual recovery and overall recovery of your eye will take more like 4 to 6 weeks. At that time frame, your vision will feel stabilized, your brain and your eyes will be a little bit more adjusted to your vision. In addition, if you chose an intraocular lens that requires any kind of lens correction like glasses, this would be the time frame to do that. Of note, we don't use typically stitches, general anesthesia, no long recovery time with cataract surgery. Within a matter of days from the cataract surgery, most people will notice an improvement in the color and clarity of their vision, and this improvement will continue as the time goes on. There are a handful of things, though, that you should try to avoid after cataract surgery. Namely, in the immediate postoperative period after your surgery, try to avoid touching your eyes, try to avoid rubbing your eyes, try to avoid lifting heavy objects, anything typically over 20 or 25 pounds. Try to avoid using poses where your head is below the level of your heart, such as yoga poses or doing gardening, where you're bending down and your head is below the level of your heart. Ideally, you also want to avoid applying makeup to your eyes for the first week or so. And in addition to that, you want to avoid getting into any kind of pools for at least a couple of weeks after your cataract surgery. There are a number of different factors that can impact how quickly you recover from cataract surgery, and these include your overall health, the severity of your cataract, what type of intraocular lens you choose, as well as the skill level and experience of the surgeon that you choose. Also, as far as medicated eye drops go after the procedure, at Lucent Vision, we typically offer a type of dropless cataract surgery, where all of those medications, including steroid medications and antibiotic medications, are placed inside of your eye at the time of the cataract surgery so as to reduce your burden in the postoperative course. Typically, most of our patients will only use lubricating eye drops that are over the counter during their postoperative course and not medicated eye drops. If you're thinking about cataract surgery, then rest assured that your recovery may be faster than you imagine. I'm Dr. Pathak at Lucent Vision, and my goal is to get you back to seeing clearly, back to the things that you love fast. If you want more information or you want to learn more, then reach out to us.